Welcome to our 50th episode of What's Crap on WhatsApp, the voice note show that investigates the crap shared in your WhatsApp groups. I'm Paul McNally from podcasting company Volume.
And I'm Taryn Willows from Africa Check, the continent's leading fact-checking organization. Today we have 3 claims to investigate.
Is it true that asymptomatic COVID-19 patients can't transmit the new coronavirus?
Will garlic help to reduce blood pressure in patients with moderate hypertension?
And is cancer the leading cause of death in Malawi?
Let's get fact-checking.
First off for today is a Facebook video claiming that studies show asymptomatic COVID-19 patients, those are people who don't show symptoms, can't transmit the new coronavirus.
It also says the US Centers for Disease Control published a review of studies and found wearing a mask doesn't stop the spread of COVID.
Whoa, okay, so surely this claim can't be true.
Since COVID-19 was declared a pandemic in early 2020, the World Health Organization has warned that COVID patients who don't show any symptoms of the disease can still spread it to others.
It also says masks are a key measure to suppress transmission and save lives.
That's right. But let's take a look at the claim. The video does not identify the woman, where she is, or where the video was taken.
Let's see. Yeah, it's poor quality, taken from an original that doesn't appear to be online anymore.
But we did find a short video on Vimeo of a woman named Lee Dundas speaking on 13 April. Based on her voice, hairstyle, clothing, and the background, it's likely that the video on Facebook shows this woman at the same event.
In the Vimeo video, she identifies herself as a human rights attorney. The video is captioned Lee Dundas, Board of Supervisors, April 13, 2021.
Right. In the Facebook video, Dundas refers to a May 2020 study in Wuhan, China. The COVID-19 pandemic is thought to have started in Wuhan.
The researchers studied 455 people who had been in contact with asymptomatic COVID-positive patients. None of the 455 tested positive for COVID-19.
But the study didn't find that people with asymptomatic COVID-19 can't transmit the virus. Instead, it concluded that the infectivity of some asymptomatic carriers might be weak.
And other studies of asymptomatic carriers have found that they can transmit the virus. But what about the claim that wearing a mask, Taryn, doesn't stop the spread of COVID?
Well, Paul, this is not what the CDC website says. A science brief on the site, updated in May 2021, quotes several studies that found face masks reduce the risk of COVID-19 infections by as much as 79%. And had led to declines in daily new cases.
The CDC also says that making people wear masks can help prevent possible lockdowns in the future. The benefits increase when people are also required to use other measures against COVID, like social distancing, hand washing, and good ventilation.
So our conclusion is that this video is crap.
Next on our crap list is a post shared on Facebook in Nigeria that claims that garlic can be used to lower high blood pressure.
It credits the World Health Organization, saying garlic helps to reduce blood pressure in patients with moderate hypertension.
According to the claim, garlic works in a way to increase the size of the arteries, which makes it easier for blood to pass. It adds that garlic gets to work almost immediately and lowers blood pressure pretty quickly. Okay, this is kind of interesting.
Yeah. The post does include an unusual warning saying, be careful, even regular consumption of garlic does not exempt from appropriate treatment, especially in people with severe hypertension.
What? Okay, so does it work or not, Taryn? Is there any scientific evidence that the garlic can be used to manage high blood pressure?
Well, let's check the facts. According to the World Health Organization, high blood pressure, also called hypertension, is when the force exerted by blood pushing against the walls of the arteries is higher than what is considered normal.
About 1.13 billion people around the world have high blood pressure, with the majority living in low and middle income countries. This leads to about 9.4 million deaths every year, says the World Health Organization.
So there have been studies that have documented the potential of garlic in lowering high blood pressure in a similar way to standard medication.
A review of trials involving garlic concludes that the vitamin B status of an individual is, quote, an important factor for the responsiveness of high blood pressure to garlic, end quote.
But a professor of medicine at the University of Nigeria in southeastern Nigeria was skeptical. He told Africa Check that such prescriptions cannot be made by doctors.
He said that until there is an approval by Nigeria's National Agency for Food and Drug Administration and Control to use garlic as a treatment, doctors are going to keep using orthodox ways for managing hypertension. This is medication and advice on managing the patient's diet.
Africa Check found no conclusive evidence to support this claim.
So it's crap then?
Dangerous crap. Experts advise that those with high or elevated blood pressure to ignore miracle cures promoted on social media and seek proper medical care.
Last on our list for our 50th episode is a claim made by a South African news website about the extent of cancer in Malawi.
That's right. With many African countries worried by the burden of cancer, the independent online news website claims that, quote, cancer is the leading cause of death in Malawi, end quote.
Malawi is a southern African country of 19.6 million people, and the publication has made this claim elsewhere as well. But Taryn, is it accurate?
Well, Paul, for information on the leading causes of death in Malawi, the World Bank recommended we look at the most recent data from the Institute for Health Metrics and Evaluations in the US.
The data from 2019 shows that respiratory infections and tuberculosis were the actual leading causes of death in Malawi, a pattern that is also observed in the rest of Africa.
Yep, in 2019, these infections accounted for 14.7%. or 17,163 of total deaths in the country.
Fifth on the list in Malawi was neoplasm, a tumor or abnormal mass of tissue that may be benign, so that's not cancer, or malignant, definitely cancer.
These caused 10,110 deaths, the vast majority being from cancerous neoplasms.
Interesting. Okay, so where is Malawi in terms of the top African countries with the heaviest rates of cancer?
According to the World Health Organization, about 70% of deaths from cancer are in lower and middle income countries. The organization's data shows that Egypt and Nigeria currently have the most cancer deaths in Africa, with Malawi not in the top 5.
But when population size is considered, Zimbabwe had the highest cancer mortality rate in sub-Saharan Africa, with 146.7 deaths per 100,000 people in 2018.
And Malawi was third, with 123.7 deaths per 100,000.
So this claim is crap then?
Incorrect crap.
That's all the time we have for today. Now you know what's crap and what's not.
Your friends and family can sign up for our show over WhatsApp. The number is 082-709-3527. Make sure to save us as a contact in your phone and send us a message.
You can find the show wherever you get your podcasts, from Apple to Spotify. If you listen there, you'll find show notes and a link to the fact checks.
We are also running a regular newsletter. You should subscribe. To do this, you can simply send us your email address on WhatsApp.
Or sign up at our website, www.whatscrap.africa.
Remember that you can send us a WhatsApp message, a picture, video, link, or voice note that you need fact-checked. Just forward them to us on WhatsApp. Our theme song is composed by John Bartman. I'm Taryn Willows.
And I'm Paul McNally.
Bye for now.
Volume.